And now the newbies. As I was coming in today, I was thinking and sitting up here, this was my third time through the University of San Diego. And where you're sitting right now was a soccer field, my first time through, when I was down at the seminary at St. Francis Seminary. When I was asked to speak here tonight, I wanted to tell a story, because that's really how I do things. I'm qualitative mind, and stories is how I do it. So bear with me if you would, please. Shortly after getting to my new position at Sharp Grossmont Hospital as a nurse manager and meeting all the challenges of trying to change culture, I came in one morning and there was an envelope on my door. It was a card, and inside the card was a story. I'd like to share it with you. One day, a man was walking along the beach when he noticed a boy picking something up and gently throwing it into the ocean. Approaching the boy, he asked, "What are you doing?" The youth replied, "Throwing starfish back into the ocean. The surf is up and the tide is going out. If I don't throw them back, they'll die." "Son," the man said, "don't you realize there are miles and miles of beach and hundreds and thousands of starfish? You can't possibly make a difference." After listening politely, the boy bent down, picked up another starfish, and threw it back into the surf. Then, smiling at the man, he said, "I made a difference to that one." My journey into nursing has been a bit out of the ordinary, as Dr. Roth has already alluded to. I didn't enter into nursing through the route common to many other incredible nurses. I didn't leave high school thinking I wanted to be a nurse. I did, though, leave high school knowing that I wanted to be a part of the healing process of the sick. I wanted to be a part of comforting them through their struggle to find health and being a source of compassion in their time of loss. All of which I would learn later are at the core of Florence Nightingale's Notes to Nursing. So while I engaged in these activities for the first 20 years of my professional life, I did so just not as a nurse. In the current cultural milieu of nursing, I am what is known as a second career nurse. However, I believe it was my first calling which ultimately prepared the way for me to discover the incredible blessing it is to be a nurse. I experienced almost every form of nursing possible during those first 20 years of my professional career. I was rushed to the emergency room to attend to the needs of a young man injured in a car accident. I was invited into the neonatal intensive care unit to comfort the family of a child on life support. I sat in a skilled nursing facility with a man who had no family and was dying from AIDS. I celebrated the joy a young couple experienced as they held their first newborn child in the Women's Center. I watched a mother courageously caress her children as she lost her battle with breast cancer while dying on hospice. And I was taken to the ICU bedside of a teenage athlete who had overdosed on Tylenol and whose parents were making the difficult decision to donate her organs. I can go on and on and on in giving examples of how experiences in my first calling helped prepare me to hear the calling to become a nurse. And I promised myself through each one of those experiences that I would never forget those individuals. While working at San Diego Hospice and the Institute of Palliative Care as a spiritual counselor, I was privileged to work with some of the most inspirational healthcare providers I have known to date. They introduced me to the importance of an interdisciplinary approach to providing care to persons at the end of life. However, not just to the individual who is dying, but equally important to the family caregiver. It was both humbling and a rich source of blessing to have been invited as a healthcare provider into those intimate final moments in a person's life. The opportunities to stand shoulder to shoulder with the many phenomenal members of the healthcare team taught me nurses do make a difference, one person at a time. My experiences in priesthood had scattered seeds which would eventually call me to become a nurse. Just as I didn't realize this as those seeds were being sown, so too was my experience at hospice planting new seeds which would impact my future journey years ahead. There were numerous individuals associated with San Diego Hospice who have had an influence in the nursing trajectory I have followed. While I didn't know it at the time, one of those persons was Dr. Patricia Roth. Her passion for quality end-of-life care, her research interest in the family caregiver, and her dedication to helping other nurses in their academic endeavors has been inspirational to many within the nursing profession. Our paths would cross again when I returned to the University of San Diego in the Hahn School of Nursing. I believe it's fair to say that nursing students, when they come into nursing school, do so with a passion for a particular area of nursing that they want to specialize in when they finish. For me, it was hospice. However, hospices normally require nurses to have some acute care experience prior to specializing in end-of-life care. So I began my nursing career on a transplant unit to gain this experience with the hope of one day returning to hospice. It was the influence of Dr. Roth and two other professors which inspired me to consider pursuing a doctorate in nursing science. When I entered nursing school, I knew, or at least I believed I knew, I wanted to provide direct patient care at the bedside. That's what I wanted to do, not research. But then I took a nursing research class because I had to, and it was taught by Dr. Ann Mayo, which changed how I saw myself as a nurse. The search for associations and relationships between variables and probing the meaning of lived experiences all resonated deeply with my Jesuit training. The impact Dr. Mayo's class had on me made me more certain that nurses do make a difference, one person at a time. While I was working on that unit, that transplant unit, my manager had asked me to represent our staff at the annual Magnet Conference in Florida. It was truly inspiring to be around so many nurses engaged and excited about learning and sharing best practices. Prior to one of the presentations, I began speaking with a nurse in the back row. I didn't know as our conversation began that she was actually the director of a hospice division at a large hospital organization in Seattle. We shared story after story about the blessing of hospice care. And we ended our conversation acknowledging how amazing it was for us to connect because of our passion for hospice. After that presentation, I did what a lot of people who go to conferences do. I spent some time, I didn't go to one of the lectures. But hold on, there's a catch here. I started walking through the exhibit hall, down the different rows, reading the different posters. As I turned a corner and entered the next row, standing in front of me was Dr. Lori Ekoff, also not at one of the lectures. I'm glad she wasn't. I hadn't seen her since I graduated from the MEPN program about a year and a half earlier. We spent a few moments catching up and promising to touch base again when we got back to San Diego, and we moved along. Both of those experiences, that director of hospice, and again running into Dr. Lori Ekoff, I could tell something was happening. Something special was happening to me. In that moment, I wasn't able to identify exactly what, but in looking back on it now, I can once again see how nurses make a difference, one person at a time. It was with the encouragement when I got back to San Diego and meeting with Dr. Lori Ekoff and Dr. Kevin Maxwell, another USD graduate, that I decided to return to the Hans School of Nursing to begin my doctorate studies. My dissertation, probably to no surprise to any of you, was focused on family caregivers of persons with dementia on palliative care. Now, since earning my doctorate about 18 months ago, I've had a lot of time to think about one of those probing questions that Dr. Eileen Freibauers would always ask us. So what is next, Michael? I don't have an answer to that question. And you know something? I'm okay with not having an answer. If my journey has taught me anything, it is when you least expect, a new door will open. As a result of my research, I've been able to continue to build relationships with leaders of Sharp hospice care. I hope, as I continue to engage them in dialogue, additional research projects will become available, and that as a nurse scientist, I can make a difference, one person at a time. When I stopped to think about challenges to nursing, I had to go back to Florence Nightingale. Florence taught us that nursing is rooted in the ability to demonstrate empathy for patients and to bring healing through the art of human touch. I come from a previous profession that can speak quite well to this. If we lose sight of this foundation, I worry about our identity, our being recognized as one of the most trusted professions, and our own realization of the blessing that it is to be a nurse. It can be lost so easily. Our challenge then, as members of this profound vocation, is to ensure it does not lose the aspect of caring which is so central to its calling. Saint Teresa of Calcutta, better known as Mother Teresa, once said, "I know God would not ask of me anything I could not do. I just wish he didn't trust me as much as he does." As nurses, we are called to care for the sick, suffering, and dying. And when we are done with those acts of caring, we must remember to care for one another. This is what I see as a tremendous strength of this profession. The dedication and commitment of many nurses who take the time to pay it forward and become the shoulders for the next generation of nurses to stand with. They are the true exemplars of what it means to make a difference, one person at a time.